Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today my special guest is Dr. Phillip Craft. Dr. Craft is a board-certified plastic surgeon from Miami. His website is Body by Craft, and he is a specialist in cosmetic and plastic surgery, especially for the breast and, in fact, all the contouring of the body. So really looking forward to find out what he's got to say today. So welcome to the show, Dr. Phillip Craft.
Thank you so much for having me, Neil. Thank you.
Well, let's get a little bit more into your background. You are a plastic surgeon down in Miami. Tell me a little bit about yourself, your education, and how you got into plastic surgery.
All right, it's a super interesting story. My father was a plastic surgeon, and growing up at the dinner table and in the car going to school, all we talked about was how to make women beautiful and how wonderful plastic surgery is on being able to restore somebody's shape. And after schooling and going to school and kind of watching him do some surgeries, I was super excited about it and decided to make that my final career, which has been absolutely amazing. So I did all my education, did my plastic surgery residency, and got boarded in plastic surgery. And now have been in Miami for about 17 years, which is one of the top destinations for cosmetic surgery, and have really had a good time with it, and specializes in breast and body contouring.
So let's talk a little bit about that specialization. I like in these interviews, I like to hone down on maybe one area that you specialize in. So what would you say that is the most popular, or what you do most of?
Down here in Miami, the desire for cosmetic surgery is super high. And these women, after having children or having lost a lot of weight, their bodies just need to be kind of made over. You know, they lose a lot of volume in their breasts. They get a little extra skin laxity in the abdomen. And probably the number one thing that we see down here in Miami is the mommy makeovers, which is really just like a breast tightening and maybe an implant to make the shape of the breast nice and round and natural looking, and then making the abdomen as tight and flat, putting the muscles back together, and then sculpting out a beautiful, beautiful waist to give them an hourglass figure like they had when they were younger.
Mm-hmm. Now, obviously, plastic surgery is not a new thing. It has been around for many years. And tell me a little bit about the history of plastic surgery and why is it so popular right now?
I mean, what we've seen is that at the very beginning, it was more just enhancing the breast. Back in the 70s, it was doing breast augmentations on ladies that have either lost weight or have never had breasts, and they just wanted to restore their self-confidence and just get a nice look and better balance. And over the last probably 10 or 15 years, then you started to see more of a contouring, which is taking a little liposuction cannula and sculpting out the figure that you've always wanted, you know, making your inner thighs nice and flat, making the lateral saddlebags on your thighs a little bit more straight so you look good in a skirt or your jeans, or making your waist super deep. So after the breast, then came the body sculpting, and then once the girls started having C-sections and the lower incisions from childbirth, they started getting a little extra skin, and then when we started doing the mini tummy tucks, which is like a shorter version of a full tummy tuck. And then the ladies that really have problems with extra skin or problems with their muscles being too loose, we started doing full tummy tucks. And that's kind of where it's gone today. And we've gotten to the point now that we can take a look at the pictures of what they look like 15, 20 years ago and try to turn back the clock and make them look like they've always wanted to look, or make them look like the way that they did before children.
I mean, that's definitely an attractive proposition, to turn back the clock and, have the body that you might have had 15, 20 years ago. I can tell why it's really popular. But talk to me about some of the problems, and you mentioned a couple of them, just, having babies and not having the same body shape, but what problems are you really solving for them?
Well, every patient's a little bit different, whether it's a young girl or a middle-aged male or a middle-aged female. But with all this cosmetic surgery that you see in all the magazines and all this cosmetic surgery that you see on TV, it's really brought cosmetic surgery out into the mainstream. And the problems that can be solved are many. All the way from a lady that has huge breasts that can't exercise, we can do a nice breast reduction. And in the past, you do just a breast reduction just to remove volume. Now we concentrating on a breast reduction to actually make the breast looks, super perky and round and gorgeous. So it's more of a artistic reduction than like the old and the 10 or 15 years ago, the way we used to do it in the old times, which was just reduce it and not really care the way that it looks. It's attention to detail and trying to restore that look that they want. But, the guys after about age 40 with their testosterone and hormone changes, they start getting fullness in their chest and they become self-conscious about it. So we do some sculpting and some removal of breast tissue on the chest to make it look nice. Again, I'm 50 years old and I have some love handles that I would love to have removed just because, I eat healthy and I exercise a little bit, but genetically I have little deposits of fat that I would love to have removed. And it just takes 1 hour and you can remove it and recovery is a couple of days. And, there's nothing to it. It just feels sore. So there's a lot of little things that can be done easily with very small recovery times that if the patients would just say, let me just go check on this, that they can get it done and they love it. It's amazing.
Yeah, let's talk about that as well. That might be a misconception for some people that surgeries are, going to be or are going to come with a lot of pain and also a lot of recovery time. But in today's day and age, it's not quite the case. Explain for a breast reduction surgery we're just talking about. Explain what kind of process women would go through there.
Sure. So the main complaints that a female would have is that, their breasts are way too large. They can't exercise, that underneath the breast, the skin is hard to keep it nice and dry, or usually the complaint is that they have to wear their bra so tight that it hurts their shoulders. And by the end of the day, they're just kind of slumped over and just too heavy. So those patients, they come in, I show them how we do the reduction. In other words, I draw with a little crayon and show them where the areola position should be in the normal position, and then how I tighten the sides and how I tighten the whole breast to make it nice and round, and then give them an idea of what they're going to look like by kind of putting it together in front of a mirror and saying, this is where it should be. This is the look that you should have, and it needs to be balanced with your body and your shoulders and your waist and your hips, and just kind of get them excited about removing around 1 pound to 2 pounds of breast tissue that they don't need, that if they get rid of, that they're going to actually feel better the first post-operative day than they have all day in a bra that's too tight. That surgery takes about 2.5 hours, about 1 hour each breast, and about maybe 30 minutes just to fine-tune the incision so that all the sutures that are absorbable and they're underneath the skin are completely hidden so that it looks like we haven't even been there. And then once that's done, then the recovery is about 1 hour in the recovery room, and then they wake up knowing, they don't even know they even had surgery yet. Then they go home and they're just sore. Pain medicines is really not a painful procedure. It's more of a tight procedure. So they're going to need something like Advil or a Tylenol or something for mild to moderate discomfort, but it's mostly a tight feeling that they have. So recovery on that is about 2 weeks to take it easy. No exercise, but normal activities. And that's really it on the breast reduction. Is really just removing and making smaller and prettier. So the recovery is pretty quick.
Well, I like to go to Google and find out what people are actually typing in when it comes to something like breast reduction. So I've got a few questions here, so I'm going to give you a rapid fire round right here, Dr. Craft. Okay, so
Sure.
Will breast reduction help lose weight?
Okay, that's a great question. If you do a breast reduction, in fact, I have one tomorrow that's absolutely huge. If you do a breast reduction and it's a big breast, you're gonna remove at least a pound on each side. So automatically you've lost 2 pounds. But then the way that you feel about yourself with a new look, and now your ability to be able to exercise with the breast not getting in the way of your normal exercise, could it help you improve your ability to lose weight? And the answer is yeah. You can instead of wearing 2 sports bras, now you can wear just a normal little workout bra and look good, feel good, and help motivate you to lose more weight and look your best.
Mm-hmm. All right. Will breast reduction help back pain?
Oh, for sure, because you're taking away that weight in the front, and you're taking away the weight that the bra has to suspend that weight off of your chest. So absolutely, it helps your posture. It helps that feeling of the bra digging into your tops of your shoulders. So absolutely, it helps for weight, for posture, and just overall, just you feel good at the end of the day because it's not heavy.
Mm-hmm. All right. Here's I'll just do one more here. Will breast reduction scars go away?
Anytime that you injure the skin, you're going to have a scar. But as long as you close that scar as precisely as possible, it'll look like the seam on a tailored suit or on a tailored dress, is that you'll just barely see that line, and all of those sutures, just like in a tailored suit or a tailored dress, are all underneath the fabric, just like the way that I sew. I take an absorbable suture and I do several different levels of suturing, one that's deep, that's really strong, the whole detention. And then the final suture that I use is super fine, about the width of somebody's hair, and it goes right up underneath the skin just to pull those skin edges precisely together. And then once that's done, then I put skin glue, and then I put a surgical tape over the top, so that there's probably 5 layers holding that skin as pristinely together as possible. And by doing that, and then post-operatively at about the second week, start a silicone gel or a silicone tape, the scars are as good as they can be. Now, what does that mean? Well, I have pictures that are on my internet site that shows scars that are 5 years later that almost you would have to be about a foot away to even be able to point it out. So an excellent scar would be something at about 2 feet you really can't see. It looks like a stretch mark. A good scar is you can see the line, but it's super faint. Rarely do you have a scar that's like super thick. You do see it, but it's rare, especially if you do it the way that we close it with the sutures that are absorbable. Use your silicone, use your skin glue, and all that protocol to make the scars as pretty as possible.
Now, there's a balance, I think, between the conventional side of plastic surgery and then the cosmetic side, which, is really just looking good. But what kind of percentage of people do you see where there's a functional aspect, for example, the breast reduction to help the back pain or the neck pain, and then, the cosmetic side to where it's just, I want to look better?
Well, in my practice down here in Miami, it's 100% cosmetic. So I don't get to see a lot of the insurance breast reductions just because I don't feel good. These girls come in, they say, I want my breasts to be reduced, but at the same time, I want them to look like 25-year-old supermodel breasts. So it's almost like it's functional for work, but it's also functional for a bikini, which is what they want down here in Miami.
Definitely. And, I've been down to Miami, and it really is the beautiful people down there. Like everybody seems like they have the perfect body. I guess it's really needed down there just to fit in, would you say?
Oh, no, for sure. I mean, if you think about all the cities in the United States, how many of those cities where you would do plastic surgery are you really showing off your body? New York's a big place, but everybody's dressed up in clothes, so they tend to need liposuction because they eat too much during the winter. And then you have California, the water's super cold, so they get in the water. Not really, but here in Miami or in this part of the United States, I mean, these girls wear the most beautiful clothes and the most beautiful bikinis, and they look amazing. And like I had a girl today that's a little Russian, looked like a little supermodel that had a perfect figure, but she wanted to have a little extra sculpting of the waist. You want a little extra sculpting of the inner thighs and outer thighs that she really didn't need. But she wanted me to take those areas, make it even better, and put the fat in the upper breast because she didn't really want a breast implant. And I told her, I said, you know, you look amazing. You don't need it. You look beautiful. If you want it, it can be done. It can be done safely. It can be done easily. And yeah, you get everything. You'll have a little bit more full breast, but yet conservative because it's not going to be a fat. You really can't use a lot of fat in the breast, but it would be just enough to push her from a 9 to a 10 on the scale of what a girl would look like if you were going to rate them. You know, just super beautiful.
So let's talk about the mental, internal aspect of getting cosmetic surgery. Talk to me about the way it helps improve people's lives by feeling better about themselves.
You know, that's really the main reason that we do cosmetic surgery is to give somebody a little bit more self-confidence, whether it's a 17-year-old girl that is just super, super flat and doesn't have any breast shape and wants to look good in a dress. You know, that's a quick fix and it's safe. You know, it's a 1-hour surgery, put the implants in. After about 2 weeks, when the swelling's completely down, they're ready for their dress, and it really changes them. I mean, it kind of sounds like, oh, that doesn't really do anything for the person, but I can tell you, I see these girls come in and they're kind of shy, and they say a couple of words, and then you do breast implants on them, and then the next time they come in, they have a good looking blouse on, and they've kind of changed their hairstyle. And they're bubbly and they're super excited. And it's like you kind of change them from somebody that you wouldn't even know was in the room until that they're like, when they walk in, they're like the superstar of the party. You know, it's unbelievable how it influences even the young girls like that. Or I have a guy that he's super good looking, but he doesn't like the look of his chest because he's got a little bit of fullness behind the areolas. And he's super obsessed about it. And, you know, to the point where you and I would look in the mirror and say, man, he looks good. I mean, I wouldn't do anything, but you know, our job is to help the patient get what they want. And if we give them what they want, then that's going to make them feel better about themselves, which is going to make them have a better day or help them improve their self-confidence. So, you know, you do a little 30-minute procedure and you remove the tissue for the guy with the chest and he's flat and he's super happy. Or you have the lady that's lost 100 pounds and has a loose skin, and she looks amazing, except now she just has a super, super loose skin that's hanging down to her mid-thighs, and you take that skin away and you show off that new figure that she's worked hard for with diet and exercise. And many times I'll come into the room after one of those big body lifts, and those patients will jump out of the couch and give you a hug and say, you know, this is a life-changing experience. This is what I knew I could achieve, and here I am, and thank you so much. And it's those times that I really enjoy my profession is when the patients get super happy. You know, it makes it worth it.
Yeah, you can really make a remarkable difference to somebody's life by making them look better and feel better about themselves. But let's talk about the negative side. And we've all seen these images of plastic surgery gone bad. And, you know, maybe people have been addicted to plastic surgery. What is going on there? Should these operations have been done to somebody that's already had a ton of plastic surgery? Is there a time where you tell your customers, your patients, no?
Yeah, you know, what happens is you come in and you do a little procedure on somebody and they look amazing. Then they come in, they say, okay, well, that was easy and the recovery was amazing and I love the results. Now I want to do this. And then the next time, so it does, they kind of get semi-addicted to it. So you have to, you know, I mean, my job is to treat my patients like they were my family. I want to be honest with them and tell them exactly the way that I feel. And if I feel that we've maxed out their look and that they need to stop chasing a particular result because they're already there, then I let them know. And I say, listen, you know, I think that we have a result that's absolutely amazing. If we start trying to go too far, well, then we can start going in the opposite direction that we want to go. So I really try to guide them to a stopping point. But you do see a lot of everybody blames the doctor, but the patient is the one that keeps coming back, and keeps coming back. So both parties are to blame.
Mm-hmm.
But there comes a time when the doctor needs to say no, for sure.
Right. And talk to me about some of these surgeries gone bad. What is generally the problem where we see a botched job?
Okay, well, there's two different things that can happen there. You can have a surgeon that doesn't have a lot of experience doing that particular type of a surgery, and does the surgery because he can, even though he might not be experienced enough or have enough education to do it. He just does it, and you might have a bad result with that. Or you can have a patient that doesn't follow the directions of the doctor. And for instance, if I have a patient that really needs a full breast lift, but yet she comes and she says, I'm not ready for scars on my breast, so I just want a breast implant. If that doctor says, okay, I'll just do it, what the hell? If they put the breast implant in and the patient really needs a lift, the breast is going to look horrible because the implant's going to be where it needs to be, but the areola and the shape of the breast, the bottom part, is going to kind of look like it's on the bottom half of the implant, and then it's just going to look strange. Well, the problem is the patient is going to go to another doctor and say, look what the doctor did to me. Well, the doctor didn't do that to you. You didn't want to have the right surgery, and you settle for a different type of a surgery that's not going to give you the results that you want. And that's again, if you doctor shop for a particular surgery, you're going to get what you want, whether it's what you want or don't want. Does that make sense?
Yeah. And of course, you're a board certified plastic surgeon, but it's not really a highly regulated practice, is it? Plastic surgery?
It's not. The problem, it might not be like this in other cities in the United States, but here in Miami, they've made cosmetic surgery almost like it's a commodity. And it's like the patient wants to find the cheapest doctor with the cheapest price for the cheapest stuff. And, what you're paying for, it took 15 years for me to go to school, get my education, to get my diploma, to be able to do what I do. Some doctors do a little dermatology, or they do a different type of a route, and they have like a 1-month course to say that they get a certificate to be a cosmetic surgeon, and that's just it's not the same thing. So you're really paying for the best doctor you can. You're paying for their education, their experience, and their long history of doing incredible work, and that has a good reputation, and a lot of patients that praise his results. It's like anything else in life. It's sometimes you do get what you pay for, and here in Miami, it's just the opposite.
Yeah, when it comes to your own body, I would definitely invest in a specialist when I was, looking for work there. But, I really like your last name is Craft. Your website is bodybycraft.com. And it really is a craft, too. It's obviously the experience that you have and the education that you have, but there is an art and a craft to it as well, being a good plastic surgeon.
Absolutely. It takes an artistic eye, number one, and then it takes years of experience to know what works and what doesn't work, so that you can give the patient what they want. If I was going to build a house, I wouldn't go find somebody that's never built a house yet. I'd go to a guy that I can see on my neighborhood builds the best houses, and I'd have him build my house. I wouldn't just have somebody build it. That's going to be mine forever. So it's same thing with your plastic surgeon. You want to find somebody that has a good reputation, that has good reviews, that has some nice pictures before and after, and that you like. And if you do that, you're not going to be one of those ones that shows up on TV with surgery gone bad or all that. You're going to get a nice result, and if you find a good doctor, he's going to stand behind his work. And if you need a little adjustment here and there, he's going to do it for you. And that's what we do.
Excellent. Well, Dr. Craft, it has been a pleasure speaking to you and talking about all these different issues and questions and problems that people have about seeing a plastic surgeon. If there's something that we haven't covered yet that you would like to mention, what would that be?
I mean, if you've ever wanted to go to the ultimate body shop, here in Miami is where it's at. We restore and improve the body you've ever wanted. So come on, we'll have fun.
Okay, and is cosmetic surgery available for everybody?
Sure, absolutely. I mean, not everybody's perfect, and if you have one or two little areas that you think that you would look better with a little improvement, can it be done safely and easily? Absolutely. I mean, most surgeries take about an hour, and the recoveries on most of those surgeries is about 2 days to 7 days. On the bigger surgeries, is 10 days to 14 days. So you just find some time that you can take care of yourself and allow everything to heal. And then you're going to be able to get into the back of your closet in all those beautiful clothes and start putting on clothes that you haven't been able to wear in a long time.
And I imagine this time of year is probably a fairly busy time for you.
It's super huge. I mean, with the Christmas break and the New Year's break, everybody has some time. So they pile in just to get a little something done so they can kind of lay low with the family and recover and have people take care of them and just enjoy their time healing and knowing that they're going to look better in the beginning of the new year.
Well, I know that you have a very special day today, and you have a wife who's waiting for you. So I appreciate the time that you have spent with me today. And would you like to leave your contact information so anybody listening can get hold of you, your website, phone number, email?
Sure. I would be glad to leave all that. And again, any questions that they have, that they can call me and I'll answer them over the phone. And in that way that they can at least have somebody they can bounce questions off of. And that's what we're here for. My job is to try to keep people steered in the right direction and try to help them avoid mistakes.
Okay, so let's get that on the audio here. Your website is bodybycraft.com. And what is the phone number?
Our phone number? Now, that's a good question because we're in the middle of a move from the downtown Brickell area to the Miami Beach area, but I'm not even sure what the phone number is. It's the old phone number is 786-358-0177.
Okay, well, we will definitely get the correct phone number in the show notes. So if you're listening, just check out those show notes. And the number will be there, but it will be on the website, bodybycraft.com. Well, again, Dr. Phillip Craft, he is a board-certified plastic surgeon in Miami area. I invite you to go to his website, look around, see some of the pictures, and contact him. Miami's a great place to go to get some plastic surgery done with board-certified plastic surgeon, Dr. Phillip Craft. Thanks for being my guest on Business Authority Radio.
Thank you, sir. Thank you for having me, Neil.
And to our listening audience, if you like what you hear, hit that like button and share, and we'll see you next time in the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.